Good afternoon to all those who have joined us for this webinar. Just to start with some logistics, for most of the webinar, we will be muting the lines, but you can feel free to use the chat box in case you have a pressing question. At the end of the webinar, we will end up unmuting the lines so that you can ask any specific questions. And hopefully over the next 30 to 40 minutes, we're going to be able to give you an overview of the variety of options in order for you to be able to disseminate your educational work. So most of this particular webinar is going to be focusing on publishing, and there are many different ways that we can disseminate our work. So one of them is through papers, some is through books, some people are now tweeting a lot of their manuscripts, or at least referencing their manuscripts. There are also podcasts. The most important thing is that we want to be publishing. So hopefully this will give you some sense of what avenues you have available to you. So the goals of this webinar are to help you appreciate the variety in the types of educational scholarship, to learn about the different venues and options for educational scholarship, as well as to identify strategies for selecting the best venue to disseminate your work. So let's first start with reviewing the writing cycle. So all good educational projects start with an idea. Just like Pooh Bear here, who's thinking away, we then must design a project, implement it, and assess it. After you analyze the data, the next step is writing, and then editing, and then hopefully, where we're going to focus most of our attention today, is on publishing. So how are we going to do that? What types of work are best suited for our academic journals? Which are better suited for social media or other venues? So the first step is to decide on the following 4 questions. So what are you actually trying to accomplish? Usually the goal of publishing is for you to share your ideas and disseminate your work. Next, you need to decide on who are you trying to reach. So is your audience primarily medical students, trainees, other educators, other radiologists, maybe other practicing physicians, or maybe you're actually trying to reach lay people? So your choice of venue could vary dramatically depending upon which audience you're trying to reach. For example, a few years ago, I was working with members of my state radiological society on the adoption of the breast density notification law in our state. And as part of this work, it became clear to me that the biggest actually gap in knowledge was in physicians outside of radiology as well as with our patients. And therefore, our working group, interestingly, decided to write a perspective on the topic. And instead of choosing to publish it in a radiology journal, which is what everybody kept telling us to do, we actually opted to publish our perspective in the New England Journal of Medicine because we knew that that particular journal reaches a much larger audience. Now, the third question you want to ask is, how are you going to go making this happen? So depending on the venue, you need to understand what the reviewers as well as what the editor might be looking for. So a peer-reviewed, high-quality journal will have different expectations than hosting a podcast or even MedEd portal. And these are all different types of venues that we're going to be talking about in a further detail a little bit later. So you really do need to do your homework up front, and so you need to go online and search your potential options. All of the academic journals provide guidelines for submitting articles, and it's important that you follow those recommendations if you want to maximize the chance of acceptance. The other venues also will have specific asks, and they also expect that you will meet those expectations. So even MedEd Portal now looks for at least some data to suggest that the curriculum or resource is proven to be effective. The final question you really have to ask yourself is, why is this important? So as Petra Lewis had mentioned earlier in one of our previous webinars, it's important for promotion and for getting recognition for your contributions. So your work will not be published or disseminated if you're unable to justify its value or its contribution to the field. So what are some criteria to keep in mind if you want to be able to disseminate your work? So first, I think and foremost, you need to have clear goals. You need to know what you're trying to accomplish. Second, you need to have knowledge of the prior scholarship in that area and this will be incorporated into your work. It's not enough to just show that your curriculum works, but you need to place its relevance amongst the existing knowledge. Third, the methods must be readily justified and appropriate for the topic. So assessing an educational intervention often entails a combination of both qualitative and quantitative evaluation. And this data must be captured as objectively as possible and ideally using validated tools. Fourth, we hope that everything we do produces meaningful results. Although most journals want to publish positive results, it is useful to also publish something that shows that the intervention had no effect or possibly even a negative effect. Fifth, I think the manuscript must present the results clearly and in an organized manner. The reader must be able to understand the results and hopefully be able to draw a parallel to their own teaching. And finally, the discussion needs to include a reflection on how this work fits into the big picture by relating it to prior scholarship and accounting for any study limitations. So let's start with choosing a topic and deciding authorship. The topic must be of interest to a general audience and ideally add new information to the existing literature. It really needs to be a coherent whole project. It's getting more and more challenging to actually publish a needs assessment without evaluating the curriculum that was created to address the deficits or to just describe a curriculum that you developed. Even, as I said earlier, MedEd Portal is now looking for an assessment component. The other thing to keep in mind is that there's no such thing as honorary authorship. All authors are really expected to contribute substantially to the design of the study, the implementation, the data analysis, and manuscript writing and editing. The first author is the primary person who will actually physically get the project done. The second author generally is the person who puts in the second highest amount of effort. And the last author is somebody who oversees and mentors the entire project and all the authors, but also is expected to fill in if the other authors need help. So all authors have to contribute substantially in order to be listed on whatever you decide to disseminate. The International Committee on Medical Journals of Editors recommends that the authorship be defined by meeting all of these 4 criteria. And the 4 criteria are as follows: substantial contributions to the conception or design of the work, or the acquisition, analysis, or interpretation of data for the work, and number 2 is drafting the work or revising it critically for important intellectual content, and final approval of the version to be published, and agreement to be accountable for all aspects of the work in ensuring that questions related to the accuracy or integrity of any part of the work are appropriately investigated and resolved. Nearly every journal now complies with these ICJME guidelines, and anytime you are submitting a paper to a journal in particular, you will, or all authors will be expected to sign off and acknowledge that they have participated in all 4 criteria. Oh, just to go back, the other thing is co-authorship in medical education is actually discouraged. In some of the scientific journals, which we're not talking about scientific research at this point, they do allow co-primary first authors, but this is something that, at least in the educational literature, is actually discouraged and not recognized. So let's move on to the types of scholarship. So let's start with research. So educational research is defined as usually being original research over, probably centered around a curriculum, some form of a systematic review or meta-analysis, or possibly you could write a research letter. The other type of scholarship is a review article. So there are multiple different types of reviews that you can write in education on specific topics. Or in medical teacher, they have actually a 12 tips series that sometimes might fit into what you're trying to convey. And of course, there are always book reviews. In terms of innovations, these would be more descriptive papers of new approaches or solutions to problems, or some new ideas. And these are things that you can actually publish in multiple different radiologic journals. You could do singular observations, and although you can write case reports or have a short narrative, I will tell you that for promotion purposes, these singular observations are not going to be as highly valued in the promotion pathway. Another option is actually to write an opinion piece. So this would include your editorials, your perspectives, your letters to the editor. And, certainly I think some perspectives can really be useful and can be, well recognized for the promotion purpose. So I do think these opinion pieces actually can add value because sometimes the data does not exist and that we need some opinions from experts in the field, from expert educators to share their knowledge and to offer an opinion on how best to handle a certain topic. And then finally, I would say one of the things that we're seeing more recently is that people are now choosing to publish using multimedia. They're adding clinical images, they're adding videos and podcasts, and many of the journals actually have podcasts that go with some of the published articles. And this often can add a dimension to your work and potentially make it a bit more accessible to a much broader audience. I do think that some of the promotion committees still struggle with what to do with some of these multimedia components and how to actually recognize them, but there are metrics that can be acquired that you can use to document the value that they may have added. So let's move on and talk a little bit more in depth about the types of educational research. So for true educational research, first thing to keep in mind, which I believe you have a webinar on potential grant funding, but there is grant funding through these three major organizations to support educational work. And some of these grants will even allow recipients to use the funds to better their career. So I have seen some people receive grant funding and go on and actually have professional career development by acquiring a master's in education or even a PhD in education. Certainly it's not necessary to do that, but it is actually a potential option. Now the reviews also can range from narrative reviews of a topic to book reviews or overview of a specific topic using, for example, that 12 tips series that exists in Medical Teacher, which is one of the educational journals. So I think there's a lot of different types of scholarship. In terms of innovation, there are many innovations that do happen in education, and these papers tend to be more descriptive, but nearly every journal or website is looking for a proof of concept. So I think even in the innovation category, you would want to have some data, whether this is in the form of a pre-test with a post-test, or possibly some more qualitative feedback. Now, the singular observations are case reports, which can be published in the Journal of the American Medical Association or the Annals of Internal Medicine, which occasionally do take case reports, and narratives still are possible, but I would again say that this kind of work in the educational field is not weighted very heavily in the promotion pathway. And there's just fewer and fewer venues now for case reports, although, the American College of Radiology has the case in point. Those are essentially case reports that are now available online. So if you do want to be promoted, I think your greater impact is to focus more on some of the other categories of scholarship rather than focusing solely on case reports. So opinion pieces don't typically have much data, but these contributions do serve as a means for discussion. And writing editorials or perspectives to the editor can bring about a discussion centered around a critical issue. And of course, your perspective matters, and I think this cartoon probably captures that the best, as the person stuck on a little island is looking and excited about the boat, and of course the person who's on the boat, when they see the land, is so thrilled to see an island that they could actually get off of that boat from. So your perspective does depend on how you perceive a situation. And then another type of scholarship is multimedia. So, there are many ways for us to share images, to share our curricula through the internet, through YouTube, through journals, through social media, and we'll be talking a little bit more about those potential options a little bit later. So here are our possible venues. We can do educational research, there are perspectives, there's how I do it. All of these journals listed below do publish this kind of work. And then on the right-hand side of your screen are other potential options. MedEd Portal, which we'll talk a little bit about more, different websites, whether they're sponsored by a society or whether you create your own individual website to disseminate your work. Podcasts and TED Talks are another potential option, social media. And then, you could still write a textbook, quite a big undertaking, but there are still radiologists that are choosing to disseminate their work through textbooks or become a question writer for some of the standardized exams. So traditionally, academic journals are what promotion committees are looking for. So what do these journals look for? That is, how do you maximize the chance that your paper will be accepted? And essentially, if you think about it, there are three key factors that they're looking at. The project's significance, so how does it add value to what currently exists? Its impact on the practice and the relevance to that specific journal's readership. So you first need to determine the significance of your work. Does it pass what we would consider the so what test? Will anyone outside of you be interested in learning about your work and what you've accomplished? So if it can pass this so what test, you have a much greater chance that this will be something that you can successfully publish in one of the leading academic journals. You also need to find out just figure out whether your work is original and does the data actually support the conclusions. Are your methods statistically valid? Did you follow ethical research practices? You need to determine the impact of your educational work on clinical practice or on science. And then the other thing that most editors really do focus on, because they're concerned about their impact factor for the journal, is do they think this article is going to be citable by others? And so this is something that does go into the equation as they're trying to decide whether they're going to be accepting or rejecting your manuscript. You want to make sure there's clarity of message and your data is presented in a very coherent way. And then finally, you need to really determine if you think this work is appropriate or relevant to that specific journal's readership. So you really do need to have some idea and do your homework to figure out who is the audience for that specific journal. Keep in mind that the editor of these journals is really looking for that highly citable manuscript. And so we're going to turn our attention to now talk a little bit about the different options for us as radiologists as we're looking at some of these journals. So the two main journals that we have are Academic Radiology, which is the journal for the Association of University Radiologists, and the JACR, which is the journal for the American College of Radiology. And both of these, I think, are really great journals because they really do have a lot of educationally focused manuscripts. The Academic Radiology Journal recently had a change in leadership, so Dr. Reed Dunnick is our new editor-in-chief, and he's very much interested in having a significant portion of every issue having educational content. And so this journal really does accept papers that are purely educational research. We do encourage people to submit perspectives. Some of these actually do get invited. There are teaching and learning moments, which is a piece where you can reflect on a specific incident in your career or life and provide some insight to others on how to best handle that situation or maybe to share what you might have learned. And then there's a section that's on how I do it, so you can share how you actually teach a specific topic. There is an annual dedicated education issue, although as I just mentioned previously, we're really trying to increase the educational content with every issue. JACR is also a great potential option because this also will publish educational research and perspectives. It also has more of a health policy bent, so some of the topics that you might want to be publishing on may fit better in JACR or may actually fit better in Academic Radiology. Both of these journals, though, are outstanding sources for you to consider as you're trying to figure out where to submit your work. Now, outside of radiology, there are a couple other journals that you should keep in mind. So Academic Medicine is the journal of the AAMC. And you can see here, again, it publishes educational research, trends in curricular reform, anything about competency-based education and educational innovations. So this is, again, very broad categories, but academic medicine, again, if you think about it, is an audience beyond just radiologists. And so depending upon what you're hoping to disseminate, you may want to try to seek a broader audience. The same is true for the Journal of Graduate Medical Education, which is published by the ACGME. This does focus a bit more on residency and fellowship education, but again is a great sort of venue to consider if you, again, want to try to disseminate your work beyond the confines of radiology. A few other journals to also consider is medical education, as well as medical teacher. So medical education publishes primarily qualitative studies and very brief innovations, whereas medical teacher is going to publish research, even guidelines, the best evidence in medical education, sort of review articles, and it also does these 12 tips series, which is really a unique way of, somebody disseminating kind of in narrative format an approach to dealing with maybe an educational challenge. A couple other journals to keep in mind is Clinical Teacher. So Clinical Teacher will focus primarily on clinical education. It also does have some shorter reflective pieces that can be submitted, and it also it commissions some articles that more are on a toolbox to summarize different curricular options, and so these commissioned articles are another potential option as well. And then Teaching and Learning in Medicine tends to focus mainly on program evaluations and case reports. And then more recently, there's a newer publication, Simulation in Healthcare, that obviously, given its topic, would be publishing on topics related to simulation. Finally, a couple other pretty well-known journals is the Journal of the American Medical Association and the New England Journal of Medicine. And what's interesting is we as radiologists often don't think of it's publishing in either of these two journals, but we really ought to consider disseminating our work through this, particularly if it's on a topic or curricular concept that does span across specialties. The Journal of the American Medical Association does have a dedicated issue in September to education. However, they really are looking for the multi-institutional trials, some kind of systemic or meta-analysis review, or studies that would have a high impact on outcomes. The New England Journal of Medicine, I think, although they might publish an educational research project, more commonly I would say that the avenue for us would be maybe writing an editorial or perspective on a specific topic. And that brings us to another particular venue. So besides the journals, the AAMC created a MedEd portal, which is basically an online repository of peer-reviewed resources. And here is the actual web address that I put on the slide for you to actually go and look at it. What's nice about this resource is it has a huge repository of online tools that some are specifically already designed for radiology, but many can be adapted into radiology. It's international, it is open access, and at this moment in time, there are about 3,000 downloads monthly. So I think by putting your work or your curriculum up on MedEd portal, you certainly are reaching a very, very large audience. They are also able to provide you with some metrics. So in terms of promotion, that's going to be important, particularly if you created this curriculum, you want to be able to document that people are using it. Now, it was recently selected for inclusion in Medline, which means you now can be tracked. The problem with this is that instead of just being able to upload a curriculum now and provide the facilitator's guide, you're also going to need to be able to provide some data to show that your curriculum is useful. Now, another alternative venue would be websites, and there are some people who do create their own internal websites. I have a colleague here at Beth Israel Deaconess Medical Center in Boston, Jillian Lieberman, who actually created e-radiology learning modules and has her own individual website. There's also the website Learning Radiology, which I know that many medical students use. So this is definitely one option, but of course, I think for most of us, we would have to have somebody who's very computer savvy to set up the website such that it's, reliable and can be also very interactive. The nice thing about getting involved in AUR is that you can actually sometimes collaborate with societies in order to disseminate some of your work. So this webinar, along with all the others that are part of this educational scholarship grant that we received through AUR, will be available on the AUR website as a resource for all of our members. There's also professionalism curriculum that is on the AUR website already. There's a biostatistics curriculum that was done by Andrew Rosenkrantz and others. So many times this may be another venue by which you can get your work to a much broader audience. The same is true for APDR, so if you happen to be a program director or an associate program director, there are lots of opportunities to help develop resources that could be used across the country and possibly across the world. So these are things for you to also keep in mind. So what about podcasts and TED Talks? So basically this would be entailing videos and audio sharing of educational research projects or specific educational topics and challenges. Again, these two resources are generally open access and allow you to reach a very broad audience. For the TED Talks, you're really seeking to provide information in very small bites and very quickly. And this technology can enable educators to be able to share their work very quickly as well as to a broad audience. So this is another potential opportunity as well. And then, of course, there is social media and YouTube, which is one form of social media, but you can also have Facebook, Instagram, and a few other different apps that you can use. You can do videos, you can do, your entire curriculum could be posted potentially. You can also tweet. Twitter is now becoming a really powerful metric by, sharing your work. You can actually track how many people are actually following you and then potentially tweeting back about using your educational content. So tweeting can help bring attention to your work. And again, all of these resources are generally open access. And what's interesting is in the current volume of the New England Journal of Medicine, there's a perspective by Shilcutt and Silver on the pros and cons of social media, specifically for female physicians. And what's interesting in this perspective, they reported on a company called Almetrics, who calculates an overall attention score. So it's something, basically it's a score over the overall attention gained on individual social media platforms and numbers of mentions in conventional media and policy reports. So this is an alternative metric that will complement the typical H-index and citations that we see when we publish or disseminate our work in an academic journal. And even more interestingly, in that same perspective, in 2016, apparently Mayo Clinic reported on a framework for attributing social media scholarship into their promotion criteria. And that can actually be found in the Journal of Graduate Medical Education by an author by the first name of Cabrera in 2017, volume 9. So I do think promotion committees at some of the institutions across our country are now starting to recognize that disseminating your work through social media does have significant value. So educators can also make meaningful contributions by serving as question writers for either RAD exam or the ABR certifying exams. And although this may not be regarded as highly as educational research, it is an educational endeavor that really should be notified or noted on your CV. Because it does demonstrate that you are being recognized as being more of an expert in a specific area. Finally, I thought we'd end with textbooks, many of which are now digital rather than actual hard copy. But they do provide a more traditional mode for disseminating information, and although most of our millennial learners are much more into digital, There are still some people out there that really prefer the hard copy textbook. Either way, most companies are usually providing the entire content in both formats so that basically you're trying to reach many different people across the world. Often with textbooks, you will get royalties. The thing with textbooks, though, to keep in mind is particularly in education, if you're doing a lot of innovative things, textbooks become very outdated pretty quickly. And it's a big undertaking to even update the textbooks. So I think there may be other venues that are probably easier for a majority of us to get our work out there. So let's summarize a bit and talk about some strategies for success. So one of the big things that we had mentioned earlier is that you want to set very clear goals and decide on what your message is. You want to design and implement the study if it's appropriate to study it, but generally you're going to be probably developing curricula and you want to assess it and be able to have some particular data to show that your curriculum or your intervention was successful. And then most importantly, you need to choose the appropriate venue, taking into account which audience you're trying to reach. And so we've gone through a whole bunch of potential options, and I think depending upon who you're trying to reach will help you decide which is the most appropriate venue to pursue. So what is stopping you from success? This is one of my favorite cartoons because although most of us would like to go to Paris, we really do need to publish because that is what will make you to be a successful clinician educator and will help you to become promoted to that next level. And finally, I would like to thank Dr. Grace Wong. She's an internist at my institution who provided some of the content for this talk. She had created a guidebook for scholarship, which was part of a presentation at our Academy of Medical Educators in 2016, and I really do want to acknowledge her help with this presentation as well. So with that, I think I'll stop and I'll open it up to any questions. Thanks so much for listening. I don't see anything in the chat box. I must have made everything very clear. So thank you very much. And I look forward to seeing many of you contribute substantially to our literature. And hopefully this talk on the different venues of educational scholarship was helpful. Thank you.